In today's video, I'm going to be talking about the keto diet, its effects on diabetes, and the pros and cons for those who are planning on switching to this diet or simply interested in how it works. What is a ketogenic diet? A ketogenic or keto diet is a high-fat, low-carbohydrate eating plan. Typically, it looks something like 70 to 75% of your daily calories coming from fat, around 20% from protein, and only about 5 to 10% from carbohydrates. To put that into perspective, a standard American diet gets roughly 50% of calories from carbs, so keto is a drastic reduction. How does cutting carbs so dramatically actually affect your body? Normally, your body runs on glucose, a simple sugar coming from carbohydrates you eat. But when you dramatically restrict carb intake, usually below 50 grams per day, your body eventually runs out of its glucose supply. At that point, your liver kicks into gear and starts breaking down stored fat into molecules called ketone bodies. This metabolic state is called ketosis and is where the diet gets its name. Your brain, muscles, and other organs then switch to burning these ketones for fuel instead of glucose. This shift usually takes anywhere from 2 to 7 days of strict carb restriction to fully kick in. Foods you'd eat on a keto diet are things like meat, fish, eggs, cheese, nuts, butter, avocados, and non-starchy vegetables. Foods you'd avoid: bread, pasta, rice, most fruits, remembering that the whole point of this diet is to restrict carb intake. Okay, so how does this have an effect on diabetes? Quickly, let's cover what diabetes is. In type 2 diabetes, the body either doesn't produce enough insulin or doesn't respond to it properly, a condition called insulin resistance. Since insulin's job is to help cells absorb glucose from the blood, this causes blood sugar to stay dangerously elevated. Type 1 diabetes is different. The pancreas produces little to no insulin at all, requiring patients to manage blood sugar through an external insulin source. Here's the theoretical connection to keto. If you're barely eating carbohydrates, there's much less glucose entering your bloodstream in the first place. Less glucose means less demand for insulin and less strain on a body that already struggles to manage blood sugar. Studies have shown that keto diets can significantly lower blood fasting glucose levels, reduce HbA1c, which is a key marker for long-term blood sugar control, improve insulin sensitivity in type 2 patients, in some cases allow type 2 diabetics to reduce or even eliminate their medication under medical supervision. For type 2 diabetes specifically, this is exciting because it targets the root cause, too much glucose in the system, rather than just managing symptoms. Pros and cons. Let's talk about the upsides. The most compelling positive is blood sugar control. Multiple clinical studies have found keto diets to be more effective at reducing HbA1c than standard low-fat diets for type 2 diabetics. Second, keto can lead to significant weight loss, which itself improves insulin sensitivity and reduces diabetes risk factors. Third, it may improve cardiovascular markers like triglyceride levels, which tend to drop significantly on keto and can raise HDL or good cholesterol. And finally, many people report fewer energy crashes and more stable energy throughout the day because their blood sugar isn't spiking and crashing with every meal. To be fair, keto is not a perfect solution and there are some real concerns. Firstly, it's hard to sustain. The diet is extremely restrictive, cutting out bread, fruit, and most grains, a significant lifestyle change, and many people struggle to maintain it long term. In the first week or two, many people experience headaches, fatigue, brain fog, and irritability as their body adjusts, the quote-unquote keto flu. Because so many food groups are restricted, keto can lead to deficiencies in fiber, potassium, and certain vitamins if not carefully planned. Most studies on keto and diabetes are short-term. We don't yet have robust evidence on what happens after 5, 10, or 20 years on the diet. To wrap things up, ketogenic diets show real promising potential for managing blood sugar and improving outcomes for people with type 2 diabetes. But like any medical intervention, it's not one size fits all, and it all comes with genuine risks that need to be taken seriously. If you or someone you know has diabetes and is curious about keto, the most important thing is to talk to a doctor or registered dietitian. Thank you.